India, and they say that most of the antimicrobial resistance is coming or originating from India, and that is why they have named NDM, New Delhi Metallo-beta-lactamase. They have been named because the problem is India, the rest of the world is fine. What they fail to understand is that whether it is India, whether it is United States, whether it is Europe, whether it is Australia, if a patient tends to stay in a place like an ICU, for example, then they would definitely get bugs which do not respond to normal antibiotics. It is something that I tell my patients that for the first 14 days, for the first 2 weeks, the relationship between my response of the patient or the fever of the patient, whatever the condition of the patient, or secondary infections in my patient, the relationship between the secondary infections being on the y-axis and on the x-axis is time. So till 14 days, that relationship is a linear relation. After 14 days, I don't know what happens. Everything remains the same. The nurses are the same. The doctors are the same. Everybody is the same. But my incidence of infection takes a curve and it becomes exponential. And then after 14 days, the exponential curve, where it goes, I don't know. But after 14 days, I've got no control over secondary infections in my ICU. And that perhaps tells the story of all other ICUs across the world. So getting secondary infections in the ICU, and that produced by drugs, by bugs which are resistant to commonly used antimicrobials, is a problem which is, there might be variation here and there between my ICU and a different ICU and abroad, but it is there everywhere, all over the world. The affecting organism might be different. In some part of the world, some organisms are more prevalent, but at the end of the day, that particular organism they get because they stay in the hospital. If they wouldn't have stayed in the hospital, had they got better in 7 days' time and got home, then probably they would have escaped it. But the very fact that their primary condition did not resolve, and that is why they stayed in the hospital for a longer period of time, they sort of created the environment in which they would get secondary infection. So secondary infection is something which is likely to happen because of prolonged hospital stay, because hospital is the place where these microorganisms which are resistant to antibiotics, they survive there. And if they survive there, they affect the people there. And your patient is a sitting duck, so he is more likely to get secondary infection than a general public.